Is organized by Department of
This meeting is being recorded.
So it is organized by Department of Biotechnology in coordination with Institutions Innovation Council. So Kanya Mahavidyalaya, Jalandhar, an autonomous and heritage institution, it is ranked #1 in Punjab and has top national rankings according to the survey by India Today in 2019, 20, and 21. I'm very thankful to our worthy principal ma'am, Professor Dr. Atima Sharma Dwivedi, our dynamic leader, for her constant support and encouragement to organize such events for the holistic development of the students. So I also want to extend a very warm welcome to our resource person for today's session, Ms. Deepthi Chaudhary, for today's workshop. So before we start with today's session, I just want to give a brief introduction about our resource person. So Ms. Deepthi Chaudhary is currently working as a genetic counselor at LifeCell International, Chandigarh. She's a certified counselor who has worked and did her diploma in genetic counseling under DPT-sponsored training at Department of Pediatrics, PGIMR, Chandigarh from 2019 to 20. She has worked as trainee as a medical writer in Turacos Healthcare Solution, Gurugram. She has done her master's in life sciences with specialization in human genetics from Central University of Punjab, Batinda. She has decent publications to her credit with an extensive experience in organizing events and delivering career counseling lectures and webinars. She's also involved in training various interns in the field of genetics. So welcome, ma'am. Over to you for your session.
Thank you so much, Dr. Gurpreet, for the nice introduction. And I would like to thank the institution to give me an opportunity to interact with the students, obviously, because this is the chain which is to be continued, because we have our youngsters coming into the different domains, and obviously they require some kind of a quick like knowledge to get into, because they'll be just completing their basic education in somehow months or years or like that. So thank you so much. So can I present my screen?
Yes.
Yeah. So can you just
can share your screen?
I am not able to share because it's disabled from the host end. Can you just
Shashi sir, can you please make Deepthi as host?
Yes, ma'am. Deepthi ma'am, now you are co-host, you can share.
Yeah, sure. Thank you. So hope my screen is visible to everyone right now?
Yes.
Yeah. So I believe that will be a one-way communication, because I'll be talking much about genetics and genetic counseling, but I would be happy enough to get the Q&A, like questions from the students, what kind of like thinking they do have, because that will be again an improving factor for me as well. So they can drop their questions to the chat box. So we'll be taking that in later when the session is done, right? So basically, let's just start with the basic definition of genetics. Like, what does a genetics term means? It was introduced in 1906 by Bettison. It is derived from a Greek word which means a gene, like means to become or to grow into. So obviously, every individual has become something, and they have grown into a normal individual because of we do have those genes inside us. Definitely, if we talk about the spectrum of the evolution of the branches, this is the youngest branch of biology that deals with the study of gene and the pattern of inheritance of a particular disease or a disorder. See, everybody know that we are composed of lot many cells in our body. So every cell has its beautiful nucleus, and that nucleus have beautiful pairs of chromosome, a 23 pair of chromosome every individual has in its nucleus, in its cell. And how does this chromosome DNA affects an individual? We will be discussing a bit later on. But yes, if I have used a term chromosome, I cannot forget a DNA. A DNA is a portion, a double-stranded portion, which is like beautifully compactly placed into a chromosome, and they are our like a passage of a genetic evaluation and passage of like a genetic intervention. So there are basic terms and terminologies which we involve when we talk about genes, when we talk about chromosomes, when we talk about disorders, when we talk about overall about genetics. So obviously there is one term which is called as inheritance, means something is inherited. Every individual in layman form understand what is inheritance. A layman person can say ये मेरा बच्चा है, इसने मेरे जैसे eyes को capture किया है, ये मेरा ऑफस्प्रिंग है या ये मेरे फैमिली मेंबर है, इसीलिए इसके फीचर्स मुझसे मैच करते हैं. So every layman is using this word, but a technical term says the passing of familial elements from one generation to the next. Then comes a gene, which is the basic unit of genetic information which we are learning from the class 6th or 7th, when we were introduced to these basic terminology. The gene determined the inherited characters. It is a functional subunit of DNA and contains instructions to making protein, because so we can say overall our gene is a master. He is a instructor, or he or she is an instructor making different commands to make protein and to ask them to make a normal individual work. What another term chromosome means here? A chromosome is a storage unit of gene. So we can in a very basic form we can say a gene has a house in a chromosome, a structure within the cell that deliver the genetic material as a DNA. What does a DNA means here now? A DNA is a nucleic acid that contains the genetic instructions specifying the biological development of a cellular forms. Obviously, a very compact or very complicated definition that is mentioned here, but yes, we can see a DNA has 4 nucleotides, nucleic acid, ATGC, very common. We know it since the day we have started learning. So this ATGC is forming a double-stranded structure. And this double-stranded structure is keeping an individual strong enough to work to a normal individual. Then the combined unit means the whole family of DNA, gene, chromosome fall under one roof that is called as the genome. That is the collection of the genetic information, the house where all the story begins from. So before we start, let's just not forget to remember G.J. Mendel. He was the only one person who has given us the backbone of genetics, a person who has solved the genetic mystery with single pea pod plant, obviously abbreviated as Pisum sativa. He took those pod colors, if everybody remembers that, he took those pod colors, height, the beautiful Punnett square to interpret if we mate the one family with another family, what will be the conclusion? And this conclusion from a pea pod plant was taken into a beautiful form that is called a human physiology. The individuals just like us have now understood the value of that invention, that yes, that invention holds something to us also. And the story began for human as well. So the pattern of inheritance, taking reference from G.J. Mendel, says that human cell contains 23 pairs of chromosomes. Every individual, may be a male or a female, since the day one of life, since the day the child was planned, contains 23 pairs of chromosomes, means in total of 46 chromosomes. There are 22 pairs of autosomes which are common in a male or a female, and one pair of 6 chromosomes which is a discriminating factor which can differentiate between a male and a female. So every individual has 23 chromosomes inherited from mother, 23 from the father, in total giving it a number of 46. So the 6 chromosomes, if I specifically talk about how a differentiation is created between a male and a female. So the 6 chromosome is XX for a female and XY for a male. Now, there is another term called mutant or mutation. Means like if there is any kind of like abnormality which where a person or a gene is not able to perform the desirable work for which it was designed for, is called mutation. Means the shift from a normal lyrics to a different lyrics where a person is not able to understand what the another person is trying to convey it. Talking about the person who has a mutation in any form is called affected individual. A person who is having some kind of like changes which is differentiating it from a normal individual. Then a carrier individual, a person who is appearing normal, like I'm sitting in front of you, I may appear normal, but I can be a carrier of certain disorders. So what does a mutant gene affected individual carrier means to us if we are talking about genetics? So we'll be discussing it in upcoming slides as well. So the genetics in medicine is defined as a branch of medical sciences which is concerned with the transmission of characteristics from parents to the offspring. So what does parents to offspring means? So there is a cycle in every individual that they have to become a parent, they have to create their offsprings, and the cycle goes on. So during this creation of new offspring, new individual, what is all coming up in the background? Is it something only the proteins? Is it something only the nucleic acid, chromosomes? Is it something only the normal structure is coming into image? No. There are certain other things which are coming as a backlog that may show their symptoms just after the birth, during the pregnancy, or after some later ages. So if we talk about the classification, so we have classified genetic disorders into two categories. One is congenital disorder, means a child is having some genetic abnormality since the day one of life. Day one of life, I'm not inferring in terms of like the one day when the child was born after 9 months of age. No, it's the time where the child was planned. It's the time where the people like the person was trying to conceive and they have got a new offspring. So the since day one means since the day the child was planned. Hereditary disorders means the disease that are derived either from the parents and are transmitted through gametes in the next generation. And what are those gametes? A male and a female gamete, right? So these two categories are broadly classifying two things here, like we are nowhere spared. Either we carry all the genetic information from our family where they can be normal, but we can be affected. Either we have somebody in the family who is affected, like I believe, obviously, we all have came across lot many people in our life till date, like somebody might have like short stature, a person might have, a person who is not able to hear. These are very common examples I'm trying to pick up. Who is not able to hear properly, who is not able to speak, a person who is having, limb abnormalities, the person who has multiple fingers, multiple like ear abnormalities, lot many other things like eye abnormalities, cleft lip and palate. These are the examples of hereditary and congenital disorders. So we classify the genetic disorders into four broad categories. The one is a single gene defect. The second is cytogenetic disorders, where the story of chromosomal abnormalities comes up. The disorders with multifactorial or polygenic inheritance means not a single gene is involved. There are multiple other genes, like there are certain complex disorders which comes up with like 20, 25, 30, even sometimes to 100 disorders. Like I'll just try to abbreviate that in normal Hindi term, that is किसी किसी बच्चे को दौरे आते हैं, किसी किसी बच्चे को सीजर्स आते हैं, ट्रेमर्स होते हैं बॉडी में, किसी किसी का लॉस ऑफ कॉन्साइज होता है, like history of cancers in the family. It's not just a single gene working in the background. There are multiple huge umbrella, I can say there is a huge umbrella which is, creating that problem, causing that issue. And disorders showing atypical form of inheritance, which I can say even it's a dilemma, it's a topic of conflict till date. We are not able to certain disorders, just like a neurodevelopmental disorder. A child might have intellectual disability, means he is not able to behave normally, he's behaving abnormal, a little abnormal, but we are not able to certify and signify properly, is it something gene related or is it something normal, or environmental influenced, occupational hazard influenced, or maybe some other, there can be another factors involved in it, like embryotoxins. Not many other things can come into image when we talk about the disorders with atypical form of inheritance. So if I start with the Mendelian patterns of inheritance, or the patterns if we talk about like the single gene disorder causing disorders, autosomal dominant. Autosomal dominant, what does means? It actually means, if you can refer to the image which I have mentioned here, the father is affected, a person is affected, He is married to a unaffected female. She is completely normal. And there is certain possibilities of having like a 50% possibility of having or transmitting that particular disorder to their child, right? And during this transmission, what we see is not only male, not only female, the sexes are equally affected. Again, referring to the term, usually we have one parent affected here, and the both sexes are equally affected. There is a 50% chances of a person being affected, or 50% chances of a person being unaffected. So if I refer to that image once again, a family is having comprising of 4 offspring, there is a 50% chances that their male or a female child can be affected. 50% chances their male or female child can remain normal, a healthy individual. Or like if I talk about, there is no point of carrier in it, because a carrier doesn't signify an autosomal dominant. So there are good examples of these autosomal dominant disorders. One is Huntington's disease. That is a late onset disorder where the person is having neurodevelopmental issues. Their cranial capacity, their abnormality in their brains comes up and they start behaving little abnormal. This is what I can convey the best to you guys, because you are little younger to understand this thing. Marfan syndrome, a long height, like large height syndrome, where the person is having height which is not optimum to a certain level, but not every large heighted or tall heighted person is having Marfan syndrome. There are other signs and symptoms to understand, like a wrist sign. If we see the thumb is completely not coming into this arena, and if it is coming out of this zone, there are certain other signs. Wrist sign. If a person, we try to understand in OPDs, sitting in OPDs, and we try to figure out like what kind of disorder this person is coming up with, if we have certain suspicion over. So there are certain differentials we need to understand, certain symptoms we need to see. Again, these patients have cardiac defect, they have cardiac abnormalities, they have they might have some kind of abnormal salt regulations in body. The best example for understanding this autosomal dominant is achondroplasia, a person who is having short height, जिन्हें हम बोना बोलते हैं, a person who is having short stature. It's not always that the person is cursed. There are certain theories, there are certain myths that come up with when a person is born with short height in the family. Usually the layman people will say, इसके घर में तो ऐसा हुआ था, उसको उसका श्राप पड़ गया, उसको ये वाली बीमारी हो गई, या मेरे घर में तो पता नहीं किसने क्या कर दिया, हमारे तो जी बहू को प्रेगनेंसी के टाइम पे नजर लग गया, या ऐसा कुछ हो गया. बिकॉज आई अंडरस्टैंड एंड आई हियर दीज टर्म्स इन ओपीडीज एज वेल, कि हमारे घर में किसी को कोई दिक्कत नहीं था, किसी को कोई प्रॉब्लम नहीं था, बट यही बच्चा ऐसा हुआ है. हो सकता है कि लड़की के घर वालों की तरफ से प्रॉब्लम हो सकता है लड़के के घर वालों की तरफ से प्रॉब्लम हो. बट यस, देयर आर सर्टेन इंस्टेंसेस व्हिच होल्ड्स ट्रू आल्सो. There are certain evidences which comes into like image when a person is completely normal, matlab mother father ka completely normal height hai, then too the child is having short stature, he's short in height, having short hands, short feet. That can be a random event that can come up in autosomal dominant. But yes, mostly the parents are affected. I can give you example also where I have seen a patient who was having short height. The wife was having short height, but their offspring also turned out to be in short stature. So that is a transmission of the same gene into their families. Autosomal recessive. If I talk about, let's just take a reference to the image. Mother and father equally contribute in making a family, right? But there are certain instances which comes into image, like every normal individual is not having that normal loop. They might be carrier of. Like if I'm sitting in front of you, I am speaking about these things, I never know I can be an unaffected carrier for some kind of like disorders. When I will plan my family, maybe there is a possibility my partner will have same kind of like abnormality. He is also unaffected. But yes, there is good chances of transmitting those disorders to the next generation. That is called autosomal recessive. When you are involved, but you are not really involved. And this is the largest group of Mendelian disorders, which are very frequent in observation these days, not just in North India, not just in East, not just in West, overall population, if I talk about in India, we have a sufficient amount of disorders coming into images. So there are, again, both sexes are equally affected irrespective of a male child or a female child. No. So the both sexes are equally affected here. And there are 1/4 chances of having affected siblings. 1/4 means 25% out of 100%. There is a chance either a male or a female can be affected here. The biggest example I can give here to make you guys understand, if you remember the KBC episode where the Zolenzema drug was discussed, the 16 crore drug for spinal muscular atrophy is an example of this autosomal recessive disorder. So why does these disorders have so much of cost, so much of heavy doses are required? What is the actual reason here? The genes are behaving abnormal. The genes copies are not supporting the person to behave normal. You have seen a lot of people who are having repetitive blood transfusion. A person who is going into OPDs rushing with a unit of blood every month, he or she is getting 20 units, like 1 unit, 700 grams, kind of like transfusion is happening for a person. What is the reason? Because they're both the copies are defective and the person is not able to cooperate with the life. So just to like understand, there is obviously some management being followed up for every disorder, but yes, till date we cannot be really certain that every disorder is on the verge of being cured. If I talk about cystic fibrosis, again, we have this delta F08 mutation, which is very common in Indian population. But yes, we can understand there is no, permanent cure for this. Anyhow, these all disorders are manageable. And this is the reason we are standing here, we are sitting here, having genetic consultants and genetic counselors all around. Again, the another different unit of Mendelian disorder comes into X-linked recessive, where the female dominates over male. So it's just a term says that like a female is always right, but not yes, always true, because there are certain instances where the female remains right, but can cause some harm to their offsprings also sometimes. So X-linked disorders, mostly these are a kind of like disorders which are expressed in males. Female is a carrier and she's transmitting that abnormality to their offspring. Obviously, their offspring means a male, not a female here. So if there is any female who is affected, can be a carrier, not affected. A female just remains a carrier here. She has only one copy mutated and the normal copy is working fine. So the reason here is because a male is having only one X from mother and one Y from the father. And the female is having one X from the mother and one X from the father itself, right? So these diseases are usually passed from one carrier mother to the affected child. The risk of recurrence is, like if I talk about, like half of the sons will be affected and the daughters will remain a carrier. Again, 50% chances all the males will be affected, 50% chances the males may remain unaffected if they have segregation of 1X that is normal also. So the another thing which will click into everybody's mind is like, why are we even talking about 25%, 55%, 50% if we have a good chance of having a normal individual? But seeing the load, seeing the increasing load of these genetic disorder, these 10, 20, 50% holds a significant value. If we keep on neglecting these, there will be again a troublesome thing which will not be able to understand further. So if there is a father who is affected, there are certain disorders like glycogen 6p disorders like phosphate deficiency, where the person have a good healthy life. Like if a male is affected, he might have a good healthy life, but there are certain things which need to be kept in like mind, like their diet, their medications. There are certain drugs which we avoid to provide these to males if they have this G6PD. So this G6PD has a good life expectancy. A person can remain healthy till 40, 45, 50 years of age with a good management. So if a person who is affected, if we refer to the second image, a person who is affected with G6PD marries a unaffected woman, so there are chances of having normal individuals in the family. But yes, the females will remain a carrier because they are getting that X from the father. So there are still chances that the transmission will go on, and still there is a good possibility that after one certain generation, there can be a person who might have born with some kind of like disorder. The another disorder which is common in North Indian population, for which we have done a study also altogether, in regional studies we are doing, is a Duchenne muscular dystrophy, where a male is having calf muscle hypertrophy, means the calf muscles are becoming hypertrophic, they become stiff, they are not able to sit with normal position, they are not able to get up from the normal position, and after 10-12 years of age they become completely bedridden and have a very bad quality of life. Ultimately these people expire off with a very early age. Fragile X syndrome, again, a X related disorder where the person can have intellectual abnormality. They are not able to behave properly. They have behavioral issues. They have large smile, though they are happy child, but aggressive. They will be a destructive cause also. So there are parallel kind of like symptoms that come up to a Fragile X disorder also. So if I talk about the disorders with polygenic inheritance, means involved in many physiological characteristics, just like short height, weight, color, eye color, eyebrows, the lips, the teeth, the body organs, other body organs also. So they have polygenes, but multiple genes are associated to cause one single disorder. Or there can be a person who is having complexity, like a person, there are certain instances where we see a child admitted to a NICU, PICU, ICUs, where they have intellectual issues as well, they have liver issues, they have kidney issues altogether, limb issues, lung issues. So they will not be able to have a good quality of life, and we cannot really be sure that only single gene is causing that problem. Maybe there is a possibility the spectrum of disorders might come into image, defined as governed by the additive of two or more than two genes involved. And the risk of a recurrence is 2 to 7%. Very less, but yes, not every risk of recurrence is to be neglected. And followed up by the conditions involved by the environment, non-genetic influences also, because your diet, your environment which we are living into, the water intake, the kind of like chemicals, pesticide, insecticides which we are taking in form of like food, junk foods, or like normal green vegetables because of the changing rapid environment. So these things are also causing some kind of like changes in us. Definitely they will not affect us this age, but yes, can affect, or can go and mutate our some genes that can be little a question of like little worry to the next generation. So these are the common disorders which I was referring to. Hypertension, not always a blood pressure or hypertension is because of the work profile we are carrying out into, but sometimes that can be a gene associated hypertension also, a preeclampsia during pregnancy also. Gout, diabetes mellitus. Obviously, we are now seeing the children born with diabetes mellitus, neonatal onset diabetes, or gestational diabetes. A child is having diabetes since the day one he or she was born. Cleft lip and palate, if you can refer to this image, this is called cleft lip and palate. बच्चे का तालू कटा हुआ होता है जीभ के साथ, दिस लिप के साथ में, सॉरी. सो ये चीज हमारे अंदर कहाँ से आया, कैसे आया? Yes, X-ray exposure is one common cause. The kind of like junk food intake, the kind of like embryo toxins, and obviously cosmetology. I should not forget mentioning the dermatologist and the cosmetology, which like gora hone wala cream, obviously not, but yes, the medicines which we take, like to get rid of the pimples, to get rid of like to grow long hairs, beautiful hairs, to improve our body, is not always going in right direction, because they don't get rid of from your body very easily. They keep their actions till 3, 4, 5 years. So whenever a patient is visiting to me, I definitely ask them, are you on any kind of like drug? Because these are isoteratoin, isovalerate, and these are very heavy doses. If taken during the pregnancy or taken before planning the pregnancy, can cause these kind of like abnormalities. The congenital heart defect, a person who is born with a hole in a heart, sometimes smaller, sometimes very large. ASD, VSD is the term which we use in medical. the kind of like neural tube defect, if you can see it here, the spina bifida, anencephaly, and encephalocele. These are also the disorders which are very frequent because of the iron deficiency, or I should say the folic acid deficiency in a female. And how does this 400 mg of folic acid is improving these things, improving congenital heart defect? This the additional supplementation will help a person to compensate the loss. And if there is a persistent loss, that might lead to these kind of like abnormalities. So just to sum up Mendelian disorders, if both genes are completely normal and they are happy, they will be fine. But if there is one gene which is working normal and one is sad, he's not happy to work with you, then a person can be a carrier. But as I mentioned, one single gene copy is affected in autosomal dominant also. So in terms of autosomal dominant, if your one gene is happy and your another gene is sad, then the person can be affected also. And if both genes are completely abnormal and they are not happy to work, they are not supporting your body, then it is affected. If I talk about the normal karyotype, a normal individual, the chromosome which I started in the beginning, a normal individual karyotype looks like this. How does this image comes here? How well we are able to segregate this normal karyotype here? So there is a karyotyping called karyotyping is itself a technique, right? So it's with the help of that karyotyping technique, what we do, we take a blood in this heparin vector, and 3 ml blood is taken up. We do a testing. In what way we do a testing? We start making some kind of like slides which we go ahead to, like after 72 hours of incubation, there is a long process of 10 to 12 days. Then we get a very different kind of like morphology of this karyotype. They are being very compact locations, they are being sitting in some area, and we do what we do as a person, as a counselor. What we do, sometimes we do reportings also. So we try to find out, like, if this chromosome 1 is looking like this, where is the another chromosome 1? Where is another chromosome 2? So we arrange these 23 chromosomes, pair of 23 chromosomes in a report form, in a very synchronized manner, like 1 to ranging from 1 to 23, like 22 autosomes and 1 the 6 chromosome. So what does this significance comes from this normal karyotype? Why are we even talking about it? Because if there is any kind of like abnormality to those 23 pairs of normal chromosome, the cytogenetic disorder comes into image, or the chromosomal disorders comes into image. As we discussed that there are 20 like 2n means 46 normal chromosomes in our every individual, where 23 from the mother and 23 from the father. So if there is any kind of like change from 20 like 46 to 45, means a minus in one chromosome, increase in any of one chromosome, ranging from 47, 48, 49, 50, aneuploidy, I should say, that is leading to some kind of like disorders abbreviated. Like if I talk about the chromosome 18, if the chromosome 18 is having additional copy, it is called as like the Edward syndrome, like trisomy 18. Turner syndrome 45X means a female is having one X copy and the one is absent. The Down syndrome, where trisomy 21 is the Down syndrome. Polyploidy means there are multiple copies of chromosome, like triple X, XXY, Klinefelters, XXXXX, YYYY. So there can be any kind of like abnormality that can come into image. Mosaicism means a person who is having 100% chromosome cells, out of which 25% are talking about like some trisomy 18. Some are saying the individual is having normal 46 this orientation of chromosome. Then there are two cell lines parallelly working in a human normal individual, and we do the segregation, we do fish testing on it to understand the mosaicism. We do a karyotype to understand whether this individual has to be categorized in normal form or has some kind of like intervention to be done further. So usually the structural abnormalities or the chromosome abnormalities come with different another terms called as deletion, where the chromosome is having, I'll take a reference of this image better. So deletion means a part of a chromosome is completely deleted from this, and the chromosome is missing out on that. So these deletion can also lead to some loss of information. And obviously we know that if the DNA or the genes are sitting inside the chromosome, this deletion might involve the gene also. If I talk about the translocations, translocation means if there is any kind of like information exchange between the two chromosomes, like the one chromosome has adapted the like the information from the chromosome 2, and the chromosome 2 has adapted the information from chromosome 1. So this is called balanced translocation. And these balanced translocations sometimes lead to pregnancy losses if a normal healthy individual is there, or can lead to some other kind of like, intellectual disability related disorders also. Then comes the centric fusion of like a Robertsonian translocation. If I talk about, means there is some fragment from the chromosome which has been missed out. And yes, that missing out might contain some kind of like important information, and the person might manifest some problems. Mostly, if I talk about like the chromosome abnormalities comes up with delayed development, a person is not achieving proper development, cardiac abnormality, heart related disorders, some intellectual delay, like developmental delays there, intellect is normal abnormal, speech delay. Sometimes they come up with very frequently with having limb abnormalities like polydactyly, having multiple fingers. Syndactyly means having the two fingers, like if I talk about these two fingers, they have some single bone. This is called single syndactyly. If I see, there is a syndactyly here. So isochromosomes, again a kind of like chromosome abnormality, but yes, very rarely observed. Inversions are very common for the persons who are having like infertility or having pregnancy losses. So inversion means here like there is a fragment of a chromosome which has taken a shift, means they have interacted within themselves, and there is some kind of like change which has come up. Anyhow, in some of these chromosome changes, the number remains 46, but they can give you, or they can give an individual some kind of like abnormality which is not having a good quality of life. So this is how I would be able to make you understand for the trisomies or the chromosome abnormality. So I just attended one of the conferences where I had interacted with lot many Down syndrome kids. But one thing which I was really happy about, these children are really very manageable. Second, they are getting employed. So there are few chains like BMW, Green Lemon Tree, and this The Lalit, the hotel chain. They are employing these kids because they have a good life expectancy. They don't have a bad quality of life, like unlike other disorders. So they are getting recognition, they are getting proper platforms, and they are performing well. The main issue, if I talk about having a Down syndrome child, is the child is not able to have a proper intellectual development. He is little less with the IQ. He will mimic you the way you will train these children. They will be definitely doing that in a very beautiful sense, and they are being very dedicated children. They are more dedicated than us also if we give them some command. But yes, they have some kind of like facial abnormalities, like some kind epicanthal folds, like the folds below their eyes, depressed nasal bridge. The nasal bridge is not properly formed. Tongue is sometimes protruding. They keep the child when born have the protruding tongue. The tongue is coming out of that mouth. So not every individual is happy to have these children, but yes, there are certain parents who are okay to have these children, and they are doing good. I've seen these people doing like giving career counseling lectures to other Down syndrome people, doing like Paralympics. I have met one girl who was very excellent and like having a normal vocabulary also, just because the parents are doing good input to them. The reason, due to the engagement, like we all being engaged with like academics, we doing jobs, so we are not able to rear these children with a normal, like a normal kind of like good quality of life. We are not able to provide them. So that is the reason we categorize Down syndrome to be as a very common and very prevalent kind of like disorder coming up with every kind of like age, because mostly we consider the ages to be like around 35, 40 years of age if the mother is having higher age. Yeah. So then it is a question mark of having trisomy 21. But yes, we have seen a 21-year-old female coming with high risk of trisomy 21, or like a normal person can also have a high risk of having trisomy 20. So basically, these are characterized by the increase in number of chromosome 21. If I will just drag it down, if you can just see here, the trisomy, my cursor is moving. If the trisomy 21 means the normal chromosome were supposed to be 2, but now they are 3. And the maternal age is a great factor here, influential factor anyhow for any kind of like disorder. If the mother age is above 35, we consider it to be a high risk. So about 4% of cases of are due to translocation. As you remember, if you remember, I just take you a slide back. If I have, we have discussed the translocations. Means there is a kind of like information exchange between the chromosomes, but not disturbing the copies, and the individual can remain normal. Is due to sometimes due to this translocations also, where the chromosome 21 is prominently involved. There are other chromosome abnormalities also, the Edwards syndrome, the Patau syndrome, trisomy 13, trisomy 18. I hope few of you might have gave a proper recall to it, because I see like the people nowadays are having good knowledge of, because the Google is there are a lot many things coming into these reality shows. There are a lot of people who are coming with some kind of like opinions, and we are now discussing these in medicines also. So there are multiple other chromosome abnormalities, but these are the very frequent ones. So now let's just come into I'll just go directly to my now basic domain, that is counseling. So not just genetic counseling, what does a normal counseling means? It is a consultation, a mutual interchange of opinions, where not just single person who is a consultant is giving all the knowledge to the person, but yes, we are discussing the pain of parents, the kind of like things they are being going through, the kind of like observations they do, because a parent is the first doctor to the child. And we deliberated together, we sit, we discuss, we communicate, and we come to some conclusion. So what does a genetic counseling means? So according to National Society of Genetic Counseling, it is a process of helping people to understand and adapt to the medical, psychological, and familial implications of any genetic contribution to the gene. So as we have discussed in previous couple of slides, we came to know that few of the disorders are very frequent. There are a lot many genetic disorders. So we try to make the parents adapt. We try to make them understand of the medical and psychological implications of all this. And how does it go? We'll be discussing. So we interpret the family and medical history to assess the chances of having disease or recurrence. Education about the inheritance, testing, management, prevention, resources, and research. Obviously, when you visit to a doctor, you go ahead with, like, I have a fever, doctor will examine you. They will provide you some kind of like medical treatment. If it is fine, okay, you will go on second visit and you will happily say, I'm fine. But if it is not, then the doctor might ask you to go for CBC, urine checkup. They might ask you to go ahead with thyroid workup if they have some kind of like suspicion over it. So this is what we also do in sitting in a OPD, sitting in a hospital, sitting in a cubicle. Whenever a patient comes to us, we sit, we talk, we try to understand what is his or her concern. Why is he or she is here? What kind of like family history that person has? We try to understand that. We try to figure out what kind of like inheritance it can be. Maybe AD, AR, which I have discussed in few of the slides. What kind of like genetic workup we follow here? Obviously, yes, because if there is a single gene abnormality which I am in suspicion of, obviously for that I will not offer a karyotyping. I'll have to see what test can be done. If there is a chromosome abnormality suspicion, I will not be upfront telling you, nahi, ye single gene ka test karo. I have to go ahead with the testing which is desired for that disorder. Then the management. Till the date we have the results in hand, how to manage these people, how to manage the children, how to manage the pregnancy. This all information is shared, communicated all together with a session of like 40, 45, 50 minutes. So you have to be little awake, alert to understand what the person is coming up to. So the aim of genetic counseling, as I discussed in a very a few terms, it's to promote informed decision involving the family members. Obviously, you are not the one के पर्चे पे लिख दिया ये दवाई लेनी है ले लो जाके. You have to understand how is the person taking your words, how is the person reciprocating it to you, how is the person greeting that. So obviously you have to be very empathic, very soft to them, because they are the one who are mostly mentally affected, because they never experience this kind of. Obviously if it at all happens to me, I will not be able to take it on a very good foot front until I have a good knowledge of it. Clarifying the family's option available, treatment and prognosis. You have to be a consultant, you have to be their doctor of genetics, and you have to let them know, right, this is the problem which we are suspecting, this is the treatment, and if it is coming in positive direction, we'll go ahead normally. If it is coming in some like abnormal report is coming up, what we'll have to take it forward. Explaining alternatives, what can be the alternative, because not every genetic disorder is having a permanent cure. No medications, nothing. We just have the management in hand, because if we do have the medication, talking about it is very costly. Decreasing the incidence of genetic disorder, like how can we decrease? Is it something we have to require IVF? Is it something we have to require other interventions also? Or reducing the impact of disorders. So we have talked a lot about counseling, disorders. Basically, who are the people who are doing the genetic counseling? How does a person become a genetic counselor? So who is a genetic counselor? A person who is postgraduate health professional with a graduate diploma of masters in genetic counseling. A person either having a masters in biotechnology, having masters in like life sciences, can go ahead doing a certification in genetic counseling. A person who is masters in genetic counseling is ideally a person who is a genetic counselor, who has experience in area of medical genetics and counseling. A person who has to be very good with words, good with understanding. Identify the family at risk, investigate the problem present in the family, interpret the information about the disorders, analyze the inheritance patterns and the risk of recurrence. Like what is the possibility if there is a person who is having carrier status? What is the possibility they have the genetic disorders with them? Or review the available options with the family. Like, is there any other option a family can go ahead with? He or she serve as an educator, as a resource person to other healthcare professionals. Obviously, yes, because I am very frequently involved in providing genetic support to the doctors, to the gynecs, to the neuropsychiatric disorders, or like to the neuro doctors, to the nephro doctors. Every field of like medicine, we are putting our legs in, because we have got this opportunity. To the onco doctors, so every domain where we talk about like prenatal to postnatal, I am very actively involved in. So a person who is a resource person or who is an educator, we serve as an educator to healthcare professionals and to the general public also. So the role of genetic counselor, obviously we have discussed, but I have highlighted few of the things. Whatever counseling skills you have to be empathic. You always remember that the person is visiting to your clinic is not a patient, is not a person who is coming up for a support, but a person who is courageous enough to come and talk to you, a person who is ready to understand what you want to say. Because drafting or communicating genetics to a person, a very layman person, or sometimes a non-educated person, is also a very difficult task. So you have to be empathic and open enough to understand what they are coming into. No sympathy, because you are the only one person who has to be sympathy free, because the person who is coming to you is a one who is courageous enough. We have to use non-directive counseling. We never say कि तुम्हें ये करना पड़ेगा. We never say कि करना ही पड़ेगा, ये होगा तभी होगा. You say if it is done, it is beneficial, it is helpful. आपको कभी ये नहीं कहना ये टेस्ट कराया है इसके बाद नहीं आना. You always say until this test is done, there is a possibility we'll not be able to take it forward. So you have to be very non-directive with your counseling, non-directive with your commands, because we are not there to sit and give the commands. The counselor communicates, enable, explore, encourages, and inform, offers choices, discuss, promote autonomy, and is empathic. Means every counselor has to be like very good enough tip to toe to use these words and to imply these words and to build a rapport with the patients, because developing a rapport with the patient is more important, because we have to go deep into their genes. We are not the person who will superficially examine and let them go. Important role is following up, clarifying informations, whatever we have taken, and take it into a proper support. So what are the indications of counseling? Like a person who is having more than 35 years of age, father is having above 50 years of age, a person who is having congenital abnormality, dysmorphism, I said, like not having proper orientation of eyes, nose, ears. Sometimes the child might have a ear which is not properly placed, they have low set ears, means not up to the optimum level. Developmental delay, metabolic disorders, chromosomal abnormalities, non-genetic causes, like sometimes during the pregnancy we see like there are patients coming up with less liquor, less amniotic fluid. Consanguinity being the most common factor which we need to understand, because there are certain communities, there are certain groups which practice consanguinity, means getting themselves or their offsprings married to their first degree siblings, second degree siblings, third degree siblings. So there is a huge chain going on, like a person getting married to chacha ka beta, tauji ka beta, ya unki beti, masi ki beti, aise. So this is called consanguinity, and it is the biggest, I should say, a setback for the South Indian population, because they practice maximum consanguinity, and now they are very okay and open enough to understand these kind of like abnormalities also. The teratogen exposure, which I have mentioned in like discussing the occupational hazards, and like kind of like drugs you are taking, if you are going ahead with some kind of like dermatological treatment. Repeated pregnancy losses, they, I believe you all of us might have come across a person who is having multiple pregnancy losses, they are not able to conceive. So what all these thing goes into, like always a person who is having multiple IVF failures, so what all is the cause of it, like the cancer. So this is all is the indication of a counseling where the genes are involved, where your chromosomes are involved. Being a counselor, we require a prerequisites of genetic counseling, like we have to understand, like we have to gather the information, we have to create a diagnosis, we have to do a risk assessment. The information is to be furnished very properly, because you are dealing with a person who is not very excelled with the domain, and you have to deal with a layman person also. Psychological assessment, like is the like the whatever the scoop I am giving to a person is sufficient enough, will the person is able to digest that. Breaking the bad, if I say कि नहीं बच्चा नहीं हो सकता है कभी भी, या इस बच्चे को आगे जाके ये बीमारी होगा, या बच्चा 12 साल के बाद में मर जाएगा. So breaking the bad has to be framed very properly. You have to make them understand like how to proceed stepwise, like how to make a proper informed choice, like helping them in decision making. And obviously they require a multiple support for their next generation, next pregnancies, or maybe to the, they might refer you to the some person who is having, who requires your support. So the information which we conveyed while doing a genetic counseling is to magnify the risk, which I am been talking about since the moment I have started my presentation. We have to magnify the risk, because we are the biggest magnifiers. We understand genetics better than a MD DM doctor. This is what I am very upfront telling you, because we have to be little, very okay to bear our duty, because you have to give a doctor a command. Because when I see a patient, when I examine a patient, I say a doctor upfront, go ahead with the termination, go, or either ask them to go ahead with the pregnancy, ask them to go ahead either like with this kind of like medication or this kind of like test. A doctor is the one person who will take your support very frequently, I'm telling you. So you are a supervisor who supervises, or you can say you are a bridge between a doctor and a patient, doctor and the disorder, and a patient. the impact of disease and the patient in the family, what can be the modification which can come up if there is any drug, what can be the ways, like if there is any problem like which is detected in both husband and wife, can IVF be a solution? Because before giving any kind of like recommendation or prescription, you have to be very confident enough. So we have to provide these information, like we have to anticipate the future also. Like a risk of reoccurrence is the one term which anticipate the future development of the fetus. Ethics, because every profession has its ethics, so we have to understand that we have to respect the right of individual. We cannot run behind the person and say कि नहीं ये test कराना ही पड़ेगा या you have to do this way only, then you are able to have a normal life. No, we are no one. Non-directive approach, yes, we have to be non-directive with the counseling. We cannot give a complete command. We have to maintain the privacy of the individual and the family, and we have to maintain the communication between both of us, the counselor and the client. We should not spill the beans to everybody else. Yes, we can give few of the examples, but not immediate examples, like I do. I When a person comes up with some kind of like anxiety in mind, they are hyper anxious to see like मेरे बच्चे को डाउन सिंड्रोम तो नहीं होगा. So you have to put forward few of the examples, like मेरे पिछले patient को ये issue था, then I did this, then the reports turned out to be normal. But yes, you have to frame the good and bad in both, like like a very in a single boat, you have to frame both good and bad for them. So what all does a primary tool like stand for a person who is doing a genetic counseling? What is the primary tool by which we can interpret, analyze, draw the risk? Is a pedigree. So there are few lines, few columns, few boxes we use, like few signs and symptoms like which we use to make a pedigree. This is what all has been mentioned here. Like we have, if there is a twin pregnancy, what kind of like sign is to be drawn on like a paper. If there is a normal extended family, how to correlate that family, how to draw that consanguinity. Like if I say there is a consanguineous marriage, the square is a male and the circle is a female. If they are married consanguineously, means they're relatives. Two lines to be drawn. If there is a pregnancy which is twin, like dizygotic twin, monozygotic twin, that has to be taken care of. Abortions, if there is any family who is having multiple abortion history. A person who is a proband, the one who has come for the examination, has to be marked with this arrow. So the primary tool for a genetic counselor is a pen and a paper, and the skill of drawing a pedigree. So we have to understand, above everything, follow, like taking everything into one bag is to do a genetic counseling. You have to be empathical, you have to be strong with your body language also, because sometimes I also feel like crying in front of the patient because the history is heart wrenching, but you have to stand still and firm, because you have to provide them a good direction. So the genetic screening, after all, like understanding the family history, after all taking all the informations, how to plot that into a genetic test. Us in search of, like a genetic screening is basically done in search of a apparently normal population for individuals with abnormal genes. Yes, a person will obviously come to you as a carrier, or during the pregnancy, or after the child is born. These are the three stages where we experience most of the interventions. Then we have to understand what kind of methods is to be employed. If it is ongoing pregnancy, your ultrasound is your biggest tool. You have to understand the ultrasound reports. What does fetal echo says, the cardiac echo done during the pregnancy for the fetus? What does the ultrasound says if it is done at what week of gestation? Means gestation is here the month or the week of pregnancy. So everything has to be taken care of, and this is what all you understand being a genetic counseling student. So you are being given a wholesome knowledge of genetic disorders, get understanding ultrasound reports, interpreting those reports, and how these interpretations will help you or your patient to have a better outcome. Doing some kind of like during like pregnancy workups, involving some kind of like genetic workup. So if during a pregnancy, if there is, I'm using example, if there is a pregnancy which is around 15 to 20 weeks of gestation, what kind of like test you will do if the fetus is having abnormality on ultrasound? Like if the child is having no like abnormal brain formation, abnormal limb formation, what you will do, how you will do, what is the sample you will take. So this is all comes under one roof of genetic counseling. So 1 year knowledge, 1 year understanding will give you a huge experience of dealing with such patients, dealing with such families, and in understanding their reports. So there are obviously interventions of molecular and cytogenetic testings also. So we do NIPT also. NIPT basically means when during a pregnancy, when a female is pregnant, we take the maternal blood, mother की blood से ये एनालाइज करना कि फीटस के अंदर कोई एबनॉर्मैलिटी तो नहीं है. दिस इज कॉल्ड NIPT. Karyotyping we have discussed. Fish again, to understand the chromosome mosaic conditions which I have mentioned, like how to understand if there are two cell lines. Ranging from these karyotyping fish chromosomal microarray to do a next generation sequencing of gene. As I said, our double stranded DNA holds lot many information, our gene. So how to understand those genes, why are we even talking about those disorders? So to do these kind of like testing will help the patient. How? The blood sample is taken, the DNA is extracted, the DNA is taken into amplification, they are put into big analyzers, softwares. There are huge platforms like Illumina. There are huge equipments like NovaSeq. These all tests and equipments are being employed to generate a genetic report of a patient, and that generation of report will help the patient throughout the life, right? Throughout the life, for himself or herself, to their offsprings, to their another generations also. So obviously we can take a reference from one report and we can try to interpret and understand what can be the risk of recurrence. And this is all done through the molecular and cytogenetic testings. We require a lot many other interventions as well. So the benefits is to support consultants to communicate the risk of information to their relatives, determine the outcome of the pregnancy and the quality of life of child. Helpful for the couples also who are planning their family. I said yes, as I mentioned, like a person who might go ahead with IVF later terms. Indicate possible complications. Helpful for the management of remaining like during the pregnancy. Prepare couple if there is a high suspicion and the late gestation age is quite late, like near the term of delivery, then obviously we can give a proper information to the patient, right? Yes, you are expecting your normal offspring, or you are expecting a child who might have some abnormality. So if we see, this is a huge compilation of being from a master's in genetics or master's in genetic counseling, landing into genetics and medicine, taking a reference from Mendelian disorders, plotting the pedigrees. How does a person approach to these opportunities? What are the career opportunities in genetics these days? Maybe in terms of like qualification, maybe in terms of like side side approach, you can say, or maybe in terms of like gaining some broader insight. So if I talk about in India, basically institutes offer higher education in terms of like 2-year masters and PhD in genetics, which is very well known to all of us. But yes, there are certain institutes which offer 2-year MS genetic counseling course as well as a course in masters in genetics, or like as in normal routine course, which is very well being established in Manipal Institute. That Mahi is Maharashtra campus is giving MSc in genetic counseling specifically. And there are a lot many other institutes in Punjab as well which are providing MSc in genetic counseling. But after doing MSc in genetic counseling, you have to go ahead with 1-year certification in genetic counseling. That is Central University of Punjab, Baba Farid University. This is a huge list, like Guru Nanak Dev University is also offered this MSc in genetics, and PhD in genetic counseling is also available there. Punjab University altogether, PGIMER being a medical institute in North India, has a good rapport in providing genetics and genetic counseling. Osmania University, Delhi University, AIMS Delhi. So if I say not all institute, but yes, not there are only few institutes which are lacking these days with this genetic composition. Every institute, every hospital is now well equipped with this genetics and genetic counseling. So this is a huge list of genetics institute which are providing MSc genetic counseling or MSc genetics as a stream. The institutions and certification, obviously, yes, one might be eager, if I do a MSc genetics or MSc in life sciences or biotechnology, microbiology or zoology, how will I be able to get into genetic counseling? So there are few institutes which I have mentioned here provide you 1 year certifications in genetic counseling: PGIMER, Manipal, Osmania, Kamineni Hospital. And the certificates are given or like provided to the students by the Board of Genetic Counseling India and Health Skill Counseling of India, which is supported by DBT. So DBT will be sponsoring some kind of like stipend to you. Monthly stipend will be given to the student, and they will be able to pursue their 1 year genetic counseling course. And IMA Varsity is one website where eminent geneticists like Dr. Shubha Phadke, Dr. Ratna Puri, or few of the eminent genetic counselors who have been practicing more than like 10 plus years in India, they provide their experiences. They provide a platform to educate online. So IMA Varsity is one which a person want can go ahead doing an online course, but I would be personally happy to recommend to go ahead with offline ones, because you need to sit in OPD and observe the features, the phenotypes and everything, because you have to be a little confident and understanding enough to the disorders as well. So the job opportunities in India, obviously, yes, I would say this is the biggest drawback right now. We have very few counselors working in government setups because we are slowly coming into images. It's not that, but yes, we have a very bright future. This is I'm very for sure. So there are multiple corporate sectors like Lifestyle International, which I am working with, Redcliffe, MedGerome. There are a lot many other labs like us who are being working in diagnostics, who are being giving opportunities to these genetic counselors to go ahead across India, do their genetic clinic, assist the doctors, assist the patients, and do their genetic workup. So I do come to like few of the clinics in North India. As I handle North India completely, I have my operational clinics. I have my operational, genetic counseling sessions through online, offline, both modes. So we can use telegenetics is one which is coming into images also after COVID is there. So we provide genetic counseling through this Zoom or online platforms as well. So in government sectors, slowly there is alarm which is coming into, but yes, there are few of the private setups like Apollo, Max. They have started hiring genetic counselors on their full term basis like a genetic consultant altogether. If a person who is willing to go abroad, they can go ahead taking admissions in MS genetic counseling or MS life sciences as in their like a stream, and they can go ahead doing their certifications from American Board of Genetic Counseling, Canadian Board of Genetic Counseling, and American Board of Medical Genetics and Genomics. So these are the three boards which work internationally. But yes, in India, whenever you come back, you have to go ahead and give the exit examination for Indian board, because that will give you a kind of like normal ground to deal with the normal doctors as well. So job opportunities in abroad, unlike India, we have bright opportunities in abroad. Like there are every hospital providing genetic counselor a good reputation as a consultant, and they can go ahead providing their extended support sitting in a genetic clinic. But yes, if a person who is very like excited and interested enough to go ahead with the lab work also, so they can go ahead join some kind of like corporate domains there: Invitae, Alliance Global, Prevention Genetics, and Prenetics. These are international market holders. Basically they have their services across the globe. So a person who is interested enough can join these after completing their basic qualification and after getting certified. So obviously I just come to an end with like a kind of like I should say a good message that like, this is my little walkthrough from masters, like a master's graduate to a genetic counselor. So I have published few of the articles associated to genetic abnormalities. I have provided my articles to book chapters as well. And like I have been to various international and national conferences where I have presented the Indian databases as well, like the Indian data we have, the kind of like research we are doing being a genetic counselor and consultants. So this is my little walkthrough. And before I finish, if I can see if it is working, I would like to give you a brief insight of like how we do a genetic counseling here in India, in setups, like what all genetic counseling comes up with.
पकड़ना चाहते हैं तो पकड़ लेते हैं, खेलते हैं, मतलब खेलता है, चीजों को पकड़ता है, बोलने की कोशिश करते हैं, हाँ बोलना, मम्मा पापा बोलता है, मम्मा पापा नहीं कर तो फिर अभी जैसे आप रेगुलर ओपीडीज में आ रहे हैं, तो और कोई क्वेरी आपको लगती है बच्चे के अंदर कि हाँ ये जैसे बच्चा उम्र में बढ़ रहा है तो ये पॉसिबिलिटी चल रही है कि खाने पीने में दिक्कत कर रहा है, नाम कर रहा है, खाने पीने में तो कोई दिक्कत कर रहा है, तो ये है ना कि अगर सिस्टम कम है, ये और 1.5 साल का है, तो 1.5 साल का लगता है वो छोटा सा प्रॉब्लम है, जैसे हम लोग खाते हैं, हमें तो ठीक है, जो कोई हाइट वाला बंदा छोटा लगता है, अदरवाइज नॉर्मल है, खुश रहता है, रोता नहीं है, नहीं बस हमने जो आम बच्चों की तरह है, जैसे आप इसके नानी है बच्चे, तो आपके घर में जैसे नानी कोई प्रॉब्लम और बच्चों को या सब नॉर्मल है आज और किसी की आपकी नानी की लोग किसी को सर आपकी मम्मी डैडी भाई सब भाई बच्चे का तो जेनेटिक टेस्टिंग होना था जिसमें पता चलता है कि बच्चा छोटा रहेगा, तो हमने करवाया था, उसके अलावा मतलब आप लोगों का कोई टेस्टिंग हुआ है मतलब अभी हुआ तो उसमें आया है सेम है, तो अब आगे बच्चे का मैनेजमेंट ही है सर, आपको पता है जैसे इसमें हम ग्रोथ हार्मोन्स दे सकते हैं, ठीक है, जैसे इसमें थोड़ी इंक्रीज हो सकती है, ये नहीं कि बहुत ज्यादा फर्क पड़ेगा, पर थोड़ा बच्चा बड़ा हो जाएगा, थोड़ा बच्चा बड़ा हो जाएगा तो हम उसको तब ग्रोथ हार्मोन दे सकते हैं, जो कि हम आपको पहले बता चुके होंगे, और अभी के टाइम पे बच्चे के साथ ये इसके खाने पीने का डाइट का बहुत आपको ध्यान रखना होगा.
So this is how we have seen the patients in OPDs, and we have came across lot many like good and bad experiences all together, and we have provided our extended support to the patients who require that to the maximum. So with this, I come to an end of my session. So thanks for your patient listening. For any queries, you guys can reach out to me with my mail ID, which I have mentioned here. And thank you so much.
Thank you, ma'am. So this was a really wonderful and informative session for the students on genetic counseling and various job opportunities which are how they can avail that. So there are few questions by the students also. So they have mentioned in the chat box.
Yeah.
So I can ask on their behalf. So Vani Arora has asked, what is ROR?
So basically, ROR is a term which is given for risk of reoccurrence. A risk of reoccurrence means what is the possibility the disorder will come up in the next generation? Is it something significant which is coming in one generation and will never come in another? But yes, there are certain instances where the risk of recurrence will be able to signify, like there are good chances and possibilities that the next generation might have these abnormalities which are present in current generation. So this is risk of recurrence analysis.
So then there is a question by Damanji that do our genes determine who we are?
Yes, exactly. Our genes are the building blocks. So if any gene stops their functioning, they will let us know what is the importance of being like a person who has a gene inside us. So like obviously our gene is determining factor, like how our body is working, how beautiful we look, how beautifully we speak, how beautifully we orient ourselves. So this is our deciding factor, like how we should look.
So next question, can congenital disorders be inherited?
Well, this is a kind of like conflict which is going on. It's like still there, as I see, like on the basis of my experience, the congenital defects are rare in occurrence, but yes, if the parents are having, as I discussed, if the parents are having any kind of like chromosomal abnormality as a carrier or genetic abnormality as a carrier, they can be inherited, but mostly these are de novo, means they occur in only one generation, and there are good possibilities the next pregnancy or the next generation will not have it.
And next question is, can genetic disorders be cured using oral treatment with the help of drugs?
No, no, dear. This is the biggest drawback which we are also facing. There are few medicines which have come up, but yes, there is a long way to go ahead. Now, if you understand the pharmacogenomics and pharmacodynamics, pharmacokinetics is coming into images. So this is all we are working into understand, like the patient specific drugs we are trying to generate, and we will see it's a long journey, I should say. Before that, it's very unpredictable to say like yes we have these drugs to treat that disorder, but yes we can say there are supplementations to manage that disorder, because at least if a child who is born with some abnormality, we can at least manage that child till the day he is having his life.
So one question is by Mitali. How can we eliminate the risk of genetic disorder during pregnancy?
So during pregnancy, dear, there are two choices. If the ultrasound scan is giving me some image of some abnormality per se, any abnormality, because there is a huge spectrum, and if I talk about very precisely, so that would not be a good fitting into right now, because if I see there is an ultrasound abnormality which is coming into, and we have gone ahead with a genetic workup also. So what we can do is to understand, like either we have to go ahead with the termination with the consent of the patient, because he or she is the better decision maker, and just to eliminate the risk in pregnancies, we have to do a carrier testing. Like if a parent is tested, they are being proven as a carrier or a person who is carrying that abnormality, we have to do these kind of like interventions in every pregnancy. But yes, if they are okay enough, we can go ahead doing a IVF procedure with a donor, donor, either a male donor or a female donor. So this is the best way to eliminate the risk and to reduce the risk in the pregnancy.
So that the other question is, can be diagnosed if in early stage can be eliminated. So you answered it with
Yes,
the drugs.
yes, obviously, like eliminated before the offspring. Like no, it's something like that. You know, there is a long term effect of any potent like medications which a person is going ahead with, right? So in early stages, if a patient is diagnosed, again the same thing is there. If a patient is diagnosed with a cleft lip and palate during the pregnancy, either the patient will be understanding enough to carry that pregnancy together and understand कि अब मैं baby का lip surgery कराऊंगा तो baby will look fine or not. Sometimes they are not really okay with that, they proceed with the termination. This is what their informed choices are actually. So to eliminate, we provide our choices, but yes, it's ultimate decision of the parents either to go ahead with the pregnancy or to go ahead with the terminations.
So other question is, how accurate is genetic testing by Shruti? And other question was, is there any disadvantage of having genetic testing done?
So uh, the first question is like how accurate. So it is 100% accurate if it is done in good laboratory, as I can say, because obviously followed by human errors sometimes, but not here, because it is a very consolidated test done through the sequencers, not a human intervention is involved altogether. But yes, a report interpretation is done by people like genetic counselors. So we do a proofreading of the report before it is going out to the patient or going out to the doctor. Second, what was the question? Can you pardon, please?
So is there any disadvantage
Okay.
of
So
genetic
ideally,
testing?
no, I should say no. A normal individual can also go ahead with doing their genetic workup anyway, because females who are most prone to cancers, male who are most prone to cancers like prostate cancer, colon cancer, females with breast cancer, if they have, but at least yes, if you are doing a genetic workup for a person, the person should be at the age of like 25, above 25, at least 25, because that this is the accurate age a person can take an informed decision for himself or herself. Because usually when a child who is not able to interpret the result at like 15, 16 years of age, but we are very smart with the tools and technologies, if we go ahead reading it over like Google, like breast cancer kya hai, if I know that I am 15 years of age, I see my parents have gone ahead with my workup, and I understand, oh, I am at a verge of having breast cancer at this age, I will have this. So that will give you another anxiety. But a person who is actually informed and is capable enough to understand the results, it's better to go ahead with their genetic workup.
So can any genetic mutations be repaired, and How, if they are? This is question by
We
Palak.
okay. Okay. So Palak, like obviously gene therapy is coming into images again. It's under trials only. We have bone marrow transplants. So any kind of like intervention where we can manage is going into like slowly into progresses. We have good better outcomes for the blood disorders if we are going with bone marrow or stem cell transplant to the patients. But yes, again a question mark for the other disorders. If I talk about the gene therapy for Duchenne muscular dystrophy, this is a basically large deletion on a gene. There is a excision repair therapy, means the gene which is mutated, like the portion is cut off and the another portion, completely normal portion, is being sliced off. But yes, there are good and bad outcomes also. It's still under trial, so it's very very not okay to say yes or very not okay to say no, because depends on the disorders as well.
So other question by Palak was that how should one come to know that it's time to go for genetic counseling?
Well, if you remember, I have just mentioned the indications of genetic counseling. So, if you came across, like, if I'll just make you go through one case. So, there was a case. I'll hope you will understand better. There is a family who come to me as as they have 3 pregnancy losses and 1 pregnancy affected with spinal muscular atrophy. Right? They have their genetic workup done. Second, the during the antenatal workup, means during during pregnancy, they got their workup done. Again, it was SMA positive. SMA abnormality was detected. Third time also. So the parent came to me and they were like very anxious enough to understand why it is altogether occurring. We did a parental workup. Parent workup was positive. Then we gave them an informed and consent choice to go ahead with a IVF. Then the other members in the family, because I during the counseling, during the session, the person had 6 pregnancy losses altogether, with 3 of with abnormality, 3 without abnormality. Then the person reached out to us. Then he gave me a detailed account of his family, that there is some another kind of abnormality in his sibling offspring also, who are like 28, 29 these till date. So obviously it clicked into my mind what kind of disorder this family might have. We went ahead with the like genetic workup for husband and wife altogether. We came to know that the husband family is strong enough for 2 altogether muscular dystrophies like SMA and limb girdle. Then the other people in the family, they approached me up for their extended workup, like just like premarital counseling. Few of them came up with the premarital counseling. Few of them came up with like pre-pregnancy counseling, pre-conceptional, I should say. So the right time is when you realize that there is some kind of like history in the family, or altogether you want to cut down the risk for yourself. Like if I am a person, like if I'll get married, before I plan my pregnancy, I would be happy enough to go ahead with a genetic workup to omit out that question mark from my mind. So it's up to you. When you have when you have an inside call, you can go ahead with that. But yes, not before 25 if you are a healthy individual.
So last question is by Atinder. How dual and quad screening test can be helpful in pregnancy?
Okay. So dual and quadruple screening is basically a screening done with maternal blood serum. So what we do here is we analyze the risk. These are the 2 factors which do 2-factor tests which are done during different intervals of pregnancy. One is around like 10 to 13 weeks of pregnancy, where we understand the risk of the kind of like biochemicals inside a female, like alpha fetoprotein, beta HCG, and PAPA. So these are the 3 biochemical markers. If they are having abnormal ranges, then it gives us some kind of like question mark to the doctor also, like whether we have to go ahead with some kind of like pregnancy workup, extended pregnancy workup, along with NT-NB visualization. Means ultrasound is done to check whether the fetus is having completely normal nose or completely normal back area, like the area behind the neck. So dual screen will help us to understand whether there are basic chromosomal abnormalities involved or not. Quadruple screening is an extended workup done around like 15 weeks of gestation, means the pregnancy is advanced right now. And if the patient has missed the dual marker testing, they can go ahead with quadruple marker testing. But obviously, the quadruple marker will not just involve alpha fetoprotein, beta HCG, and PAPA. They will involve another factors like beta HCG, estradiol. Means the biochemical marker increases with the increase in the age of gestation. So anyhow, we can magnify the risk. If there is any kind of like risks which is identified, we can involve any genetic workup or NIPT test.
So thank you, ma'am. So now I would like to ask Mrs. Navgeet, ma'am, our head of department, to present vote of thanks to ma'am.
So, good afternoon, everyone. I would like to thank our resource person, Ms. T.P. Chaudhary, for giving us such a knowledge-filled talk on genetic counseling, and especially for telling the students that what is the scope of genetic counseling in India. Because students are always like they are having a chaos in their mind that whatever we are listening or whatever we are studying, does it have any kind of scope in India or not, or in other countries. So thank you so much, Titi, for sparing time for our students and for our institution from your busy schedule. You responded to me very quickly just on a single call. Thank you so much.
No, I'm even happy enough to recall and memorize all those things, because it's a kind of like revision to me also, whether I'm going ahead correctly or not. And the question makes you stronger. Until and unless the children will ask you a question, the kids will not ask you a question, you will never be confident enough. So I'm happy enough to be a part of this institution for either in any ways, because I see girls growing is one of the biggest kind of like satisfaction to me. So I just say like I'll just see like sometimes other like sometime later I'll be there in the institute also.
Yeah, we'll surely invite you to the institution so that students can have an offline or a physical interaction with you.
I'll be happy enough. I'll be happy
What kind of counseling you want. In addition, mute your mic. And in addition to that, I would like to say that Diti, you're not just doing your job, actually you're doing something good for the society. So we are very happy to see you at this position. And in addition to this, I would like to thank our Madam Principal for encouraging us to organize such kind of events and talks so that our students can get more and more exposure for the different kinds of like activities, or we can say different kinds of research which is going on in the field of sciences. And I would like to thank my colleagues and especially Shashi sir for carrying out our online event smoothly. Thank you so much, Deepti. We'll again contact you for an offline session in future.
Definitely, I will
Thank
be
you
happy
so much.
enough. Thank you so much, doctor. Thank you. Yeah, thank you.
Thank you so much. Thank you. Shashi sir, can you please end up the session?
But please.
Students, your mics on mute.